Hi everyone. Hello. My name is Melanie Pescud and I'm a Senior Research Fellow at the School of Regulation and Global Governance, also known as RegNet, at ANU, and I also work closely with the Australian Prevention Partnership Centre. And I'm really delighted to be able to share this lecture today with you on systems thinking and the Prevention Systems Change Framework. Before I go any further, I want to acknowledge that I am here in Perth on Whadjuk Noongar country, and I pay my gratitude and respect to all of the elders, past, present, and emerging. And I want to extend that respect and gratitude to any Aboriginal and Torres Strait Islander people listening to the recording of this lecture. So welcome, and welcome everyone. It's really lovely to be here in this virtual space. I'm imagining that you're here with me and we're doing this live. And I want to offer you that if there's any questions that you have after listening to this lecture, just feel free to contact me, ask any questions. If you're looking for different readings that you want to have a look at, I can do my best to find something that will be of benefit for you with your work. So welcome everyone. And thank you so much to Sam and Penny also for inviting me to share this lecture with everyone. So I'm going to turn my video off so you can concentrate on my voice and slides. So hopefully you can see my slides okay. So as I mentioned, today we're going to talk about systems thinking and the Prevention Systems Change Framework. And I want to start with a question for you. Have you ever felt confused about systems and complexity? Because, you know, you wouldn't be alone. I definitely have. And one of the reasons might be this. The systems field is actually really big. And this is a diagram that's been put together by Professor Ray Eisen at the Open University. He's been working in the systems field for decades now. This is his book, Systems Practice, How to Act in a Climate Change World. And what he's done is he's mapped the systems field. So he's looked across lots of different disciplines like biology, mathematics, physiology, sociology, philosophy. He's looked at some of the key authors from those areas and the different theories that they've come up with in the system space or complexity space. And then you can see where this has led to some other authors and different fields of research. So this can explain why, you know, when we're talking about systems and complexity, it can actually get a little bit confusing because we might be speaking to someone from biology when we're from computing, and, you know, the jargon, the language, the terminology might be really different. So it's just something to keep in mind that the field is so big, and that's why it can get a little bit confusing sometimes. So it can be really helpful to understand where you orient yourself within the systems field. So I also wanted to just elaborate on this point and show you this map of the complexity sciences, which is pretty cool. And, you know, you can just type this into your search engine and you can find an updated version of this map. It's constantly being updated. It's interactive. You can click on it. So this is a map of the complexity sciences. And obviously on this slide, it's a little bit difficult to see. But if you look at it online in your own time, you can look at this timeline of complexity work from the 1940s all the way up to the 2020s. And this is really a work in progress as well. So people are adding to it all the time. So just to give you a sense of how big the field is, just to really elaborate upon that point, but really interesting if you're interested in looking at the theoretical home for the work that you're doing or the tools that you might be using. So let's now talk about systems thinking. And I've got this definition here that I really, really love. I think it captures it really nicely. I'll read it out to you. Systems thinking is about taking a vantage point from where you can see the whole, a web of relationships, rather than focusing on the detail of any one particular piece of the whole. And this means that events are understood in the larger context of a pattern that's unfolding over time. So really the essence of systems thinking is this ability to zoom out and see the bigger picture as well as the interconnections between the system's parts. But it's not just looking at a system at one point in time. It's not a static snapshot. It's looking to the past, to what's happening right now in the present, and looking to the future, recognizing that systems are dynamic, so they're constantly changing. And I really love using this image of a spider web to think about systems thinking. You know, if you weren't using systems thinking, you could perhaps look, imagining this is an entire big system, you could just look at a single thread of the web, perhaps around here where my mouse is, if you can see that. And this would be just looking at a single part of the system that is the web. But really, in order to understand the web, you need to zoom right out. You need to see, well, how big is the web? What kind of spider lives here? And you can't necessarily tell that from a tiny single thread. What is the ecosystem that surrounds this web? Are there any flies caught in the web, for example? So it's really this ability to zoom out and to understand the interconnections between systems parts. You know, you could look at this web before it's fully formed, and it might be very small and incomplete, and you might think, oh, that's the complete system of the web, but it's not. You've got to look at it over time as the spider builds the web. So that may or may not be helpful for you as a metaphor. So now I want to share a couple more systems thinking definitions just to really elaborate upon this point. So you can think of systems thinking as a conceptual lens or a worldview from which to think and act on complex problems that emerge from complex adaptive systems. So we say that, we say, you know, complexity arises from complex adaptive systems, and we need systems thinking to make sense of those systems and address what's going on within those systems to create change. You can also look at it as a mental framework or perhaps even a mindset that helps us to become better problem solvers by paying attention to relationships, boundaries, and perspectives in a system. And these three aspects of relationships, boundaries, and perspectives are really, really important when you're thinking about systems thinking or looking at systems. So relationships, this is really referring to those interconnections between systems parts. How do different systems parts relate to one another? Another is to think about boundaries. So if I'm studying, say, nutrition in a school, I need to decide, am I going to look within the boundary of the school canteen and what its menu is, or do I need to expand my boundary out to be looking at children's lunchboxes? Controversial, I know, just making a point. Do I need to look at the entire school, what everyone in the school is eating? Do I need to look at all the schools in that district or socioeconomic area? Do I need to expand my boundary out to look at the entire education system? Or perhaps widening out further still to look at the entire food system in which that education system and those schools fit, and that canteen fits within that wider system. So you can see boundaries help us to ascertain, where is the focus? Where do we want to place our focus? Where's the system of interest that we seek to study? And do we need to expand the boundaries out to understand a little bit more about what's happening within the system we're exploring? Another is perspectives, and I'll talk about this a little bit more later on. So this really comes into play as well with boundaries. So, you know, if I was just looking within a school canteen, the perspectives that I would get would be the canteen manager, perhaps, parent volunteers, perhaps the school principal. But if I expand the boundary out further to the school, I might talk to kids, I might talk to parents. So you get the kind of idea. As you expand the boundary out, you can bring in more and more perspectives, and you want to pay attention to those perspectives that you're welcoming in and those that you're choosing not to, and really discern why or why not that is the case. So systems thinking can be seen as a framework for seeing interrelationships rather than things, so rather than parts on their own, and for seeing patterns rather than static snapshots. So this recognition that the systems we're working in are dynamic and constantly changing. Systems thinking enables you to grasp and manage situations of complexity and uncertainty in which there are no simple answers. So really what we want to do is have this focus with systems thinking of ongoing learning, reflection, feedback, iteration. So we're constantly learning as the system we're working within or studying changes. So we're looking at connected wholes rather than separate parts, and we're learning about what they do and what they don't do. So now I want to touch upon traits of a systems thinking leader. I'm really interested in looking at systems leadership. And so I just wanted to share this one slide. It might be of interest to you. And if you're interested in doing a little bit more reading, I've got some suggested readings at the end of this presentation that you can take a look at. So when I think about systems thinking leadership or systems leadership, really, this is honing in on those tenets of systems thinking. And really, there is this idea that we can all be systems thinking leaders. We can have an influence from the place that we stand within the system, however small or large. So I'm going to read out this quote from Peter Senge and colleagues. It's from their paper, The Dawn of Systems Leadership, a really beautiful paper. It's a really lovely feel-good paper, actually, if you want to read something lovely. They speak about things like compassion, which I love, and how important it is to bring traits like that or practices like that into a system. So let me read this out to you, and perhaps you'll notice yourself in these words or someone else that you look up to or are mentored by. And I want to say before I go through this, by no means am I suggesting that any one single person should attain all of these traits, but perhaps you want to focus in on one or two. And it's really about also building teams with these traits. So having a think about that. So we want a well-rounded team, and it's really based on this distributed leadership sort of style. So though they differ widely in personality and style, genuine system leaders have a remarkably similar impact. Over time, their profound commitment to the health of the whole radiates to nurture similar commitment in others. Their ability to see reality through the eyes of people very different from themselves encourages others to be more open as well. They build relationships based on deep listening, and networks of trust and collaboration start to flourish. They are so convinced that something can be done that they do not wait for a fully developed plan, thereby freeing others to step ahead and learn by doing. Indeed, one of their greatest contributions can come from the strength of their ignorance, which gives them permission to ask obvious questions and to embody an openness and commitment to their own ongoing learning and growth that eventually infuse larger change efforts. So I just love this quote. I think it's a really nice one to print out, put above your computer if you're having a bad day. You know, have a read of this and just feel into the energy of this, this lovely quote, these beautiful traits of a systems thinking leader. Really lovely to cultivate and embody these practices and ways of being. So I've talked about systems, complexity, systems thinking, and systems thinking leadership. And now I want to talk about systems change and speak to this question of why are systems change so difficult? And, you know, we want to cultivate systems thinking and systems thinking leadership to create change in complex systems. That's why we cultivate those traits. It's not just so that we can understand a system or describe a system. It's also so that we can step forward and take action within a system and create the change that we seek to make. So it's important to recognize that there's a conceptual gap between the way in which change agents often think about systems change and the reality of systems functioning. So I want to start by showing you this diagram here on the top right. And this is from Penny Foster Fishman's work. I really love her work. And again, I've got her reference down the bottom here, and it'll be on one of the final slides of this presentation. So she says that in a sort of reductionist approach, so the opposite to a systems thinking approach, what happens is we're intervening in systems that sort of resemble a grey box. We don't really know so much about what's going on in here. We don't necessarily seek to study it in any detail. We don't seek to really deeply understand what's happening within the system. So what happens is we design an intervention, we pop it into this grey box of the system in the form of a policy change, and what we expect in this beautiful linear process is the outcome that we've planned. But in reality, that's not usually what happens when we're working with complexity. So here's another model to better sort of explain how we can best intervene in systems and have an effect. So this grey box up here is turned into multiple little orange boxes, so all the different systems parts and the ways in which they're interacting. So all those messy arrows looping back on one another. So what happens is when we design an intervention, we have a much more detailed understanding of the system that we're implementing this policy change into. So when we pop this policy into the system, we can see that it's interacting with multiple parts and that there's not this clear link between the policy and the outcome. It has to move through different systems parts to come to an outcome, which then feeds back into the system itself. So you can see why this sort of more linear reductionist way of understanding systems change might not be so effective, but when we understand and deeply, when we deeply understand the system that we're seeking to implement a change into, we can have a better chance at success. So I hope that's really helpful. I really love this diagram. I really love Penny Foster-Fishman's work. So now I want to talk to you about systems thinking for systems change. And I'm just going to press pause for a moment. Actually, it's not doing what I wanted to. I wanted to stop my pause my recording temporarily, but that's okay. I'm going to carry on. So we've talked about systems thinking for systems change, and we've talked about systems thinking and systems leadership as really essential for chronic disease prevention, which is the area that I'm coming from. But of course, it's really important for general health policy research or evaluation. And so when we see this type of conceptualization that I showed you with those two diagrams on the previous slide, it becomes more apparent as to why we need to use systems thinking in our work. And if you think about health policy, it really is our job to be able to think from this bigger picture perspective that considers multiple interacting factors and how they impact one another and the change we're seeking to make. And the need to focus very intentionally on systems change is why our team developed the PSCF, or Prevention Systems Change Framework, which is based on Penny Foster-Fishman and Erin Watson's Able Change Framework. And that brings together theory from systems theory, organizational change theory, and different implementation theories to take a comprehensive approach to change making. And so this is now what I'll go through in the coming slides. And I'm going to use chronic disease prevention as an example of a health policy research area. So the Prevention Systems Change Framework. So what is this? So this is about creating change through 4 iterative steps. And you know, one of the reasons we developed this is really because we wanted to shift the narrative from simply describing or understanding systems to actually creating change within them. I think we're really great at describing systems in detail, but often we feel a little bit hamstrung of how we should act to create change. Is it our responsibility? How do we work with different people who do have a remit to make change? So we adapted the Able Change framework and converted it into the Prevention Systems Change framework. So it's got 4 components to it. The first is applying a systemic or systems lens. So that's taking that big picture look at a system of interest. Next is applying the implementation focus. So that's really about the change making aspect. Then Then there's a couple of aspects in there that are about integrating the systemic lens with the implementation focus, and finally developing a theory of systems change. And this can be a prospective theory of change, the work that you've yet to do, or it can be a retrospective one when you're reflecting back on a project that you've done. And I'm going to go into a little more detail about that, the healthy and equitable eating study that I worked on a number of years ago, reflecting on that piece of work using this framework. So the 4 core steps, and I'm gonna, I'll have the link to this page so you can look at this paper at the end of this talk, so you'll have all the finer details to look at in your own time if this is something that's going to be beneficial for you. So the 4 core steps. So this first one is the systemic lens. So when it comes to applying a systemic lens, users are guided to think through a series of questions relating to policies within the system of interest, important connections between stakeholders and organizations, to think through who has power and influence, to think through the types of regulations in place with the system and the attitudes and values held by key players. And then finally, the key leverage points for creating change. And just to note that the questions are designed really as a guide, and we really encourage people using the framework to modify them as required to meet their contextual needs. So when it comes to taking an implementation focus, there are 4 key areas to consider. And these being the readiness of the system and its actors to create change, contingent capacities, and this refers to things like having a knowledge of the form and function of the system, understanding relationships between actors within the system, and having the skills to implement change. Diffusion is also important, which asks you to consider how to expand change-making efforts across the system. And finally, there's sustainability, which asks you to consider how new policies will be maintained, how to institutionalize new mindsets and practices, and how to support ongoing intersectoral collaborations. The next step is to integrate the systemic lens with the implementation focus, which relies on simple rules such as engaging diverse perspectives and pursuing social justice. And it also involves creating systemic action learning teams who are committed to ongoing reflection, learning, and change making, and creating small wins to maintain motivation and morale within teams. And finally, a theory of systems change is created, articulating the action and reactions to creating systems change. And this includes who will do what, who that will impact on, and what else will occur, and what is going to change with what outcomes. So a lot to take in there on that slide, but hopefully that's a decent overview. So now what I want to do is walk you through really briefly how we use the prevention systems change framework to reflect upon the healthy and equitable eating study that was conducted back in 2017 for a couple of years, funded by the Prevention Centre. So I worked on this research project with a number of really wonderful colleagues. And the short-term change-making goals as part of this project were enhancing capacities in core knowledge and understanding of the intersectoral causes of inequities in healthy eating, and shifting prevention research policy and practice mindsets towards a systems orientation. So here's my worked example going through the systemic lens. So you can see here some of the systems characteristics. There's the policies, connections and boundaries, power and control dynamics. Not enough space to have the other characteristics here. And what I did was pulled out some of the example questions to really hone in on what we wanted to know when it came to policies, etc., etc. And these are the questions that you'll find in the published paper, but what you can do when you're working through your own version of the Prevention Systems Change Framework is to just alter these questions to suit your context. So these might not be the right questions for you in terms of really getting a deep understanding of the policies, for example, in the system that you're studying. So what we then did was create 2 columns. And one was to look at to reflect back on the healthy and equitable eating study in terms of gaining a really deep understanding of the system. So this is that really descriptive part of it, looking at how did we go when it came to describing the system. And then because the prevention systems change framework is really geared towards shifting towards change making, we also had some reflections on creating systems change with this project. And so what we found was, when it came to this aspect with taking the systems lens or systemic lens of connections and boundaries, we found that in looking back, we only really focused on government policymakers, technical experts, and non-government organisations. So when we reflected back, we thought, perhaps we could have added to the richness of data and gained a lot more perspectives in the system by bringing in different perspectives. And so what we said in terms of change making is that moving forward, widening the boundaries in terms of actor involvement will be key to influencing systems change. We recognise the need to include communities with a lived experience of nutrition-related inequities. We also need to include service providers and support services and key decision makers who really have a remit to make change. So this is really about bringing in multiple perspectives and diverse perspectives and the right perspectives to not only gain a really deep, well-rounded understanding of the system that we were seeking to understand and work within, but then in terms of creating change, we not only wanted people who could really help us understand the system, but people who actually had a remit to make change. So really important there. And next, just honing in on a couple of examples, taking the implementation focus. In terms of readiness to change, we found that this was a really key thing that we needed to look at in terms of creating systems change. And this relates back to the point that I was just making before. So there's a lot of overlap typically we found between the systemic lens and the implementation focus. So he said the notion of readiness to change points to the need to include those actors with a remit to enact change in future work of this kind and who understand the benefits of and will advocate for intersectoral working. So this study being all about nutrition-related inequities and encouraging intersectoral working. So hopefully that's helpful for you. And, if you're really interested, again, grab this paper, print it out and have a look at our broad reflections across the entire project. It certainly took a long time, I must say. It's a lot of deep work doing this reflective practice. So I've just skipped over the integration of the systemic lens and the implementation focus just because of time, but I wanted to talk to you now about the theory of systems change that we pulled together. And so this was a retrospective theory of change. And just before I go into that, just want to make the point that a theory of change or theory of systems change is often quite a nebulous thing in research and evaluation. And, a theory of change can be expressed as a series of statements, a paragraph, it could be a diagram. You would have seen program logics before. I'm sure if not, have a quick search for those. But also causal loop diagrams can provide a theory of systems change. You see the system working together, all the interconnected parts and how change might happen through that avenue. So lots of different ways of expressing a theory of systems change. So overall, the retrospective HE2 project reflection process revealed how much additional work is needed over an extended period of time in order to create systems change. And while it was apparent that we had applied a systemic lens to the study of healthy and equitable eating, the implementation aspects of this type of work will require explicit and focused attention. And in considering the integration of the systemic and implementation components, we identified that while some aspects had been addressed in the HE2 project as part of simple rules in terms of pursuing social justice, thinking systemically and engaging diverse perspectives, others, such as leveraging small wins and systemic action learning teams, offer valuable potential for future work. And other noteworthy findings included the need for core skills and capabilities that facilitate systemic analysis and implementation. The importance of influence and agency was a really big one, and the value of shared understanding and common purpose to produce transformative change. So all of these reflections inform the development of this draft theory of systems change to address nutrition-related inequities. And just before I finish up, I've got a couple more slides. I just wanted to really make this point that if you're going to use the prevention systems change framework, it really is an in-depth process. You really need to take the time. It does take a lot of time to do this deep work to really understand a system. But it's really worthwhile. And, you know, often we don't pause necessarily to look at something really, really deeply. But when you do, and you really take that time, you know, it's going to pay off in the change-making efforts that you seek to make. So, you know, make sure you've got some really enthusiastic people around you who are going to come along for the ride, who help you nut out the system, think about who those actors in the system need to be, who's got power, who's got influence, how do you get this implemented, how do you keep that lovely momentum of small wins to keep everyone interested and engaged along the way. So, in a nutshell, incorporating systems thinking for systems change into our work is an important step in advancing the field of chronic disease prevention and indeed health policy research work. And the framework provides a tool to explore a complex system and articulate the types of actions needed to help us generate change. And it can be used for lots of things. It can be used to guide systems-based research planning, monitoring, study team reflective learning, and research evaluation processes. So finally, I've just got some example health policy research questions that you might like to consider for your assignment. So the first one being, what are the underlying causes of poor nutrition in remote Australian communities, and how can these be addressed from a systems perspective? And another question, what are the system-wide barriers and enablers to improving arts engagement as a strategy for addressing mental health outcomes in the general population? So perhaps you'll pick one of those questions. Let me know if you do. And finally, just some suggested readings. So, you know, you've heard me go on and on about Penny Foster-Fishman's work. So this is the ABLE change framework upon which we built the prevention systems change framework. And here's the reference here where we've created the prevention systems change framework, or adapted it rather, from the ABLE change framework and worked through that healthy and equitable eating study. And I've got some nice references here on systems leadership. So the Dawn of Systems Leadership, a journal article. If you have any trouble accessing it, let me know, I'll send it through to you. And this lovely book, if you want to make a cup of tea and spend a few hours on the couch getting inspired. This is a really lovely book, Presence, Human Purpose and the Field of the Future. All about systems thinking. You wouldn't know that from the title. So thank you so much, everyone. Really appreciate you listening, and I really hope that it's been a benefit for you to listen on systems thinking and systems leadership and the prevention systems change framework. So have a lovely rest of your morning or afternoon or evening, and take care. Thank you so much, everyone. Bye for now.